This video is for informational purposes only and does not constitute legal, financial, health, or medical advice. NEMT myths and misconceptions, medical transportation facts versus fiction. Welcome to the realm of Route Genie. Before we get to the video, make sure to subscribe to our channel so you don't miss upcoming insights into the NEMT industry. From business tips and compliance updates to the latest technology shaping medical transportation. Now, let's dive in. Think you know everything about non-emergency medical transportation? Think again. Despite serving Americans since the 1960s, NEMT remains one of the most misunderstood industries in healthcare. Today, we're busting the biggest myths that keep entrepreneurs away from this billion-dollar industry and prevent patients from accessing life-changing services. Business myths, the real truth about starting an NEMT company. Let's start with the business side. First myth, anyone with a car can start offering NEMT rides. Here's the reality. While you don't need industry experience to start, NEMT isn't Uber. You need proper licensing, insurance, and compliance with medical transport standards. If you're billing Medicaid, you must be enrolled in their program. It's regulated healthcare, not ride-sharing. Next myth, you need $100,000 to start an NEMT business. Wrong again. You can actually start with just $5,000 and a single van. Sure, you won't land massive broker contracts immediately, but private pay customers can fuel your business until you're ready to scale. Now, here's a dangerous one. NEMT is a money hack to get rich fast. That couldn't be further from the truth. NEMT operates on tight margins with strict regulations. You're dealing with ADA-compliant vehicles, liability insurance, driver training, and compliance audits. It's a real business that requires real work. Vehicle and driver reality check. People think NEMT vehicles are just regular cars with logos, unsafe and poorly maintained. Actually, most NEMT fleets use ADA-compliant vans equipped with lifts, wheelchair restraints, and first aid kits. These vehicles undergo regular safety inspections mandated by state and federal law. And those drivers? They're not undertrained and underpaid. Most states require background checks, drug testing, CPR certification, HIPAA training, and specialized vehicle operation instruction. These requirements far exceed what rideshare drivers need, so companies offer competitive pay to attract qualified professionals. Regulation and oversight facts. Here's another myth. NEMT providers operate without oversight, and fraud is rampant. While fraud exists in every industry, recent Medicaid policy changes require strict documentation and compliance protocols. Providers use GPS verification, digital logs, and undergo frequent audits. The industry is actually becoming more regulated, not less. Speaking of regulations, many believe working with transportation brokers isn't profitable. The truth? Broker partnerships can be extremely lucrative. Most states are transitioning to broker models, making this the clearest path for scaling your medical transportation business. Technology myths busted. Will Uber and Lyft replace NEMT? Not likely. Regular rideshare vehicles can accommodate wheelchairs or patients with serious medical conditions. While they might complement ambulatory NEMT services, most insurance companies and brokers still deny their use for medical transport. Another myth, NEMT software isn't needed. Try running scheduling, dispatching, and billing manually and see how that works out. Advanced software platforms like Route Genie aren't just helpful. Many insurance companies now require them for compliance. Service myths. Who really uses NEMT? Now let's talk about the service itself. The biggest myth? NEMT is only for low-income elderly people with disabilities on Medicaid. While Medicaid is the major payer and elderly disabled populations are common users, there are no age limits or disability requirements. People of all ages with temporary or chronic conditions use NEMT. Private insurance and self-pay options are available too. Another misconception, NEMT is for emergencies. It's literally called non-emergency medical transportation. This service covers scheduled trips for dialysis, therapy, routine doctor visits, and mental health appointments, not emergencies. Can you use NEMT for grocery trips? Absolutely not. The service is strictly limited to medical purposes, doctor visits, pharmacies, and medical equipment suppliers only. Quality and reliability facts. People assume NEMT rides are uncomfortable and overcrowded. Most providers offer solo transportation when medically necessary. ADA-compliant vehicles prioritize passenger safety and comfort, with drivers trained in sensitivity and disability etiquette. Is NEMT unreliable? Actually, on-time performance often beats public transit and matches ride-sharing during peak hours. Providers use GPS, automated dispatch, and route optimization. Many work directly with medical facilities to streamline scheduling. Booking complicated? Not anymore. Mobile apps, online portals, and centralized call centers make booking as easy as ordering a taxi. Geographic and financial reality. Final myths to bust. NEMT coverage and cost. Some think it's only available in large cities, while others believe rural and urban access is equal. The truth is nuanced. States must provide statewide Medicaid NEMT coverage, so rural areas are covered. However, rural passengers face fewer provider options and longer wait times. Creative solutions like volunteer drivers and hybrid partnerships help bridge this gap. Financially, many believe insurance never covers NEMT. Wrong. Medicaid is federally required to cover it, and many Medicare Advantage and private plans offer benefits too. The biggest financial myth? NEMT is too expensive for taxpayers. Studies show that for every dollar spent on NEMT, Medicaid saves between $3 and $11 in avoided emergency room visits and hospital admissions. NEMT isn't just misunderstood, it's undervalued. This regulated, cost-effective service reduces missed appointments, prevents emergency room visits, and improves health outcomes. Whether you're considering NEMT as a business opportunity or need the service yourself, understanding these facts helps everyone make better decisions. The industry serves as a vital bridge between patients and healthcare, powered by advanced technology and dedicated professionals. It's time we gave NEMT the recognition it deserves. That's it for today's video. If you found it helpful, make sure to like it, subscribe, and check out the other videos on our channel for more NEMT insights. To check out our software, follow the links in the description or scan the QR code.